Hi, Jenna, thank you very much. 8:33 now. The Omicron variant is tearing through the country, as we all know, and that's not all we have to worry about right now when it comes to our health.
Experts say, it's also flu season, and we're hearing about this Flu-Rona. So if you don't know what it is, we are about to find out.
So this morning, Dr. Andrew Martin joining us. He is the chair of Pulmonary Medicine and the director of the Post-COVID Recovery Program at Deborah Heart and Lung Center. So good morning, doctor. Thanks for joining us.
Good morning. Thank you for having me.
Of course.
Yeah, you got it. Doctor, a lot of people are getting sick right now. Of course, Omicron cases through the roof. Also flu season, as we talked about. So first things first, what is Flu-Rona? I've been hearing a lot about this.
Well, Flu-Rona, that's the name we've given to a patient who has tested positive for both coronavirus and influenza.
So are there distinct differences between being sick with the flu or sick with COVID-19? Obviously, there are some similar symptoms that we've heard about with both. So what are the primary differences, I guess, we should be looking at?
Well, the wild type corona and flu were actually very similar because the symptoms usually started out systemically with body aches and fever with little in the way of upper airway symptoms such as runny nose and sneezing and things like that. So wild type corona and flu were pretty similar. Now, corona is a more upper airway centric virus. So people with the Omicron variant tend to present more with upper airway symptoms, which are more similar to the common cold.
Mm-hmm.
All right, and doctor, flu vaccination rates are really lagging this year. Why is that, and how is this making the flu season worse?
Well, it makes the flu season worse because more people are susceptible to both infection and severe disease. I think it's lagging because there's both vaccine hesitancy and fatigue. But it's very important to understand that there is still the benefit to getting the flu vaccine, and even if you get infected, you're still less likely to have severe disease.
Yeah, it's definitely something that can be happening where people kind of concentrate on the coronavirus and the Omicron, and you kind of put the flu on the back burner. Right. So you don't want to do that. But Dr. Martin, you do have some tips for us to take care of ourselves. We're going to bring them up now, and I think you're going to be able to see them as well at the same time. So can you take us through these?
Well, vaccines are very important. Again, lots of hesitancy. I just say this to people who are hesitant about getting vaccines. Yes, there are side effects, but they're very, very rare. I really think if you're worried about that kind of thing with a vaccine, you might as well be worried about crossing the street.
Can I give you a follow-up question for the first one real quick? Is there
Sure.
any danger in getting perhaps some of these vaccines close together, whether it's the flu vaccine and then one of the booster shots or anything like that? Is that something that we need to be aware of?
There's no danger. You can get them at the same time. Some people choose to separate them so if they get side effects, they know which one they're getting side effects to. But no, you can get them at the same time.
Okay, thank you.
Wearing a mask is very important. The most important part about wearing a mask is to protect other people from the possibility that you are carrying the virus, even though you don't have symptoms, and to prevent us spreading it to each other. So that's very important. Washing your hands is important because respiratory viruses, particularly common cold viruses, are often spread through touch. We found out almost 2 years ago that not so much with coronavirus, but it's still important to wash your hands, especially if you're out in public and touching handrails and doors and things like that. If you get sick, it is important to seek medical help. And when it comes to a viral illness, you have to kind of play it by ear about how sick you are. You may get the flu and you may get Omicron, you may not have severe symptoms, so you need some advice. It doesn't mean you necessarily have to go to the hospital, but it is important to try to seek out some advice on how to manage that. Yeah. And also with both corona, well, with flu at least, we do have outpatient medicine we can give if you get them on board early enough. And we know that there's a new drug that's been approved for mild to moderate coronavirus infection that does not require hospitalization, and that is just being rolled out. Mm-hmm. That also, any of these antiviral drugs, the faster you get them on board after you have symptoms, the better they work.
All right. Well, doctor, good tips today. Thank you so much for being here. Really appreciate it. I know Flu-Rona has been on a lot of people's minds, so thanks so much for clearing up some of those questions we had.
Well, thank you for having me. Anytime.